to Richard Sloggett, who was Special Advisor to Matt Hancock, Health Secretary, and Senior Fellow at the Policy Exchange Health and Social Care Unit. Simple question. Who's got this right, Mr. Sloggett, do you imagine? Good morning.
Good morning, Nick. So I think it's slightly more complicated. So I think...
Thought it might be.
I think the issue that the survey highlights is that there is a hidden cohort of people who are waiting for treatment, who aren't captured by the official data. Now, whether that's up to 15 million or if it's down at the 4 million, there's probably some sort of truth in between. Now, if you go back to March, what happened in March? Well, whole hospitals cancelled most of their operations. GPs stopped referring patients for treatment and patients stopped presenting. Now, since then, those things haven't massively changed. We've been trying to get more people back into the NHS now the COVID pandemic is more under control. But there is a hidden cohort of people here, and counting that is very, very difficult. I think the survey tries to do it, but there are some flaws in the methodology that the Health Secretary has identified.
So the headline, the hidden waiting list of 15 million, is little alarmist and not a fair interpretation?
I would say that's absolutely right.
How will, if you will allow, and of course you might query this, but if you'll allow the NHS never really has a lot of slack, when you consider how it had to be refocused to cope with the virus, how long a process will it be to play catch up?
Well, you're absolutely right. The waiting, so you should be seen for an operation within 18 weeks from a referral. Now, that target has not been hit since February 2016. So we went into this pandemic well behind where we needed to be. Now, it's going to take an enormous effort, and funding is absolutely key here to get these waiting lists back on track. But you've also got to remember at the moment that hospitals are operating at lower capacity because of social distancing and because of cleaning and infection control measures.
Right.
We don't have enough staff in the NHS already, so that's a huge problem. And that patients themselves are still scared about accessing services. So all of those things mean that actually the waiting list is going to grow before it comes down.
Thanks for your time and interpretation. Important that we got to someone in the know. Richard Sloggett was Special Advisor to Matt Hancock as Health Secretary and is Senior Fellow at the Policy Exchange Health and Social Care Unit.